Good morning. I am Scott Poland. Thank you all for tuning in today. I'm very pleased to represent Nova Southeastern University this morning. We've had a series of webinars, all related to helping everybody cope with the virus. I know this is a very difficult time. I know that what we're dealing with is really unprecedented. There's a lot of worry. There's a lot of anxiety. I've spent the bulk of my career trying to help children and schools. And hopefully today we'll say some things that will be helpful to all adults, their families, and their children. First and foremost, I'd like everybody to just take a deep breath and know that we will get through this. There will be a future. And in the beginning today, I have used the word calm, and I'm using really every letter of that word in multiple ways. Obviously, this is a time for us to take calm. And I've even been asking some of my friends, do you even know anybody with the virus? And thankfully, I do not know anyone with the virus. And I think one of the things that's gotten lost is, thankfully, the vast majority of the people who do contract the virus, they are okay. For most people, it's simply like having a cold or the flu. So we do need to stay calm. And in particular, in our homes, we need to be consistent. And consistency is incredibly important for children. We're going to talk quite a bit today about the importance of structure and routine. And I'd like all of you to think for just a moment about what you can control. And that is really our own reaction to the virus. And of course, it's very important for us to follow all of the clear guidelines that have been provided for us. But we need to be optimistic and hopeful for our children. And the A stands for being available to listen to them. You know your children the best, but find that shared time when they will truly talk to you. I know with our son, he loved basketball. And anytime, day or night, no matter how tired I was, I would go out in the driveway, turn on the lights, and I would rebound. He'd be shooting, he's relaxed, he's doing something he really enjoys. He's telling me all these things I care about because I'm his dad. And I would respond with something really insightful based on those years of graduate study with my best. Uh-huh. Yeah. Wow. That's a hard one, son. You see, no kid wants their parents to say, do this, do that, you won't have a problem. They just want to be listened to. And one place to start is to simply ask your children, how much do you know about the virus? What is on your mind about the virus? And then simply answer their question. You know, if your 10-year-old asks you a question about sex, you wouldn't tell them everything you know. You would simply answer their question, and then you would wait for the next one. So be available. Find that shared time when your kid will talk to you. And be careful not to say too much. I learned when I would say too much, the conversation was often over. And as a psychologist, two words that I rarely use: I understand. You ever had somebody tell you that way too quickly, and you spend the next 15 minutes telling them how they do not understand? Help me to understand. I care. I am truly here to listen if you would like to talk about this. And obviously, we need to be alert to changes with our children. Now, the L stands for listening, which we've already talked about. But in addition, I believe strongly we need to limit the news coverage that we view about the virus. Somehow I doubt I'm the only person that feels jittery and especially anxious after I watch the news. I only wish there were more stories about the people who recovered and more stories about the fact that the greatest scientists in the entire world are working on treatment and a vaccine. But in particular, limit the news coverage of your children. Always keep in mind their developmental level. And if you're a news junkie, as I know some people are, well, watch all that news in a room where your children are not watching it with you. And the M stands for two really important things, modeling in particular. One of my favorite quotes is from Emerson. Emerson said, "What we do speaks so loudly to our children that when we talk to them, they cannot hear us." Your children are watching everything you do. They're watching you to decide how upset they should be right now. And the M also stands for the management in your home. Kids need a schedule. They do much better when there is a structured routine. Now, here's the easy part. This is what everybody knows. So much of this is truly just about our behavior. Washing our hands thoroughly and frequently, physically isolating ourselves from others, especially if we have the virus. Personally, I think the word social distancing is wrong. What we're really talking about is physical distancing, 6 feet or more away from others. And if you have to go out for essential things, wear your mask. These are things we can understand, and even young children can certainly do. Now, I get questions like these. My 10-year-old daughter wants to go to her friend's house. Of course, I told her no. Now she wants her friend to come to our house, and I feel like I need to tell her no as well. And that certainly is the case. But thanks to social networks and connections, our young people can be more connected than ever before outside of our homes. So that 10-year-old needs to know you can FaceTime with your friend for as long as you want today. But unfortunately, no, she cannot come to our house, at least not yet, until we get more guidance from our government. And of course, very important that any news that you do watch is from a trusted source. So a lot of parents are now performing 3 roles. You're sitting there thinking, I'm a parent, of course. Now I'm the teacher, and I'm supposed to be working from home. And unfortunately, with some of our families, maybe one member of the adults is not pulling their weight. I hear things like, my partner took the only office in the house. They're in there all day long with the door shut. They're doing their work, but how am I supposed to do my work and take care of the kids and help them with their school assignments? Well, that couple needs to have a very important discussion, and they need to trade off not only the best workspace, but trade off who is taking care of the kids during the day. And you know what my greatest hope is in the aftermath of the pandemic, when this is all over, and I know there's still a lot of uncertainty. We don't even know when that will be. And I recognize that none of us like uncertainty. It is hard not to know when something is going to end. But my greatest hope would be your children will remember the family time together. Everybody will feel more connected. you'll start some new traditions. Maybe you get one of your kids into baking. Maybe one of them is into music and you start performing some songs together. Or maybe a kid spends time with a parent in the garage learning to tinker and to fix some things. So I hope we have an entire generation of children that look back on this as something that brought their family closer together. And when you have to make a choice, whether you're the best worker, the best parent, or the best teacher for your kid, I hope you pick be the best parent. Find that time to do things with them, watch a funny movie, snuggle on the couch, bake some cookies, make your children your priority. And obviously, if it was up to me, I'd like to take some of the work pressure off. I wish that those workers that didn't have children at home to care for, maybe they should be expected to do a little more. And those of you with children get at least a little bit of a break. And I know it's difficult to balance all these things. Well, my background is that I've responded to a lot of tragedies. School shootings, natural disasters, acts of terrorism, and primarily as a crisis responder, I learned the importance of listening, not saying too much, being there with the person. And about the only thing I might ask is this simple question: who or what has helped you before when you've had to deal with something sad? Who or what can help you now? And in my previous work in the Texas schools, I got pulled into a lot of situations with a troubled employee. Maybe their partner just left, they're devastated. And when I would ask, what do you do that helps you with the normal ups and downs of life? I'd hear walk the dog, call a friend, meditation, work in my garden. And then I would ask, well, are you doing those things now? Your partner left you 4 days ago. Are you doing those things? And almost always the answer was no. We need to make sure we utilize all of the things in our life that have helped us with difficult times before. And as adults, we've actually had a lifetime of experience to draw on to help us at this difficult time. And working with a lot of Parkland parents, and I'm proud to tell you, I received the Helping Parkland Heal Award from the city of Parkland. And here's something that I truly believe. A kid who lives in a stable home, who is shown unconditional love every day, every way by their parents, they can overcome almost anything. So what am I really asking you to do? Show your children unconditional love. And right now is the time to lower the bar. What do I mean by that? Recognize the most typical reactions that children have to a traumatic event. They regress academically, behaviorally. They have worries, fears of the future, nightmares, and sleeping problems. Those aren't the unusual ones. Those are pretty much the every child ones. So they're going to regress, and they may be whining more, clinging more arguments with their siblings. And I'm asking you to respond with patience, structure, tolerance, and love. I also am asking you to forgive yourself, because I'm hearing pretty much all parents have lost it with their children, with everybody cooped up in the house. Simply apologize. I should have handled that better. I will do better in the future. Now I have a question for you. Can everybody think of the person in your life who gives you the benefit of their negativity, like every time you see them? I imagine you can visualize that person. Here is your tip for today's webinar. Stay away from that person. Seek out the people in your life that are positive and encouraging. That is what we all need right now. Here are the typical signs of adult stress. And I'm sure I'm not the only person that suddenly is waking up at like 4 a.m. in the morning. Sometimes I can get back to sleep, sometimes I can't. Some nights I sleep all the way through, maybe the next night, not so much. There's a lot of anxiety, worry, and fear. A lot of people are feeling on edge. There may be changes in appetite, energy level, activity levels, problems concentrating. Yet we're supposed to be able to get that work done at home. We may be more irritable. And to be honest, many Americans have a problems with drugs and alcohol. This is the time to try to control the intake of those substances. And none of this is easy, but it has to do with believing we will get through this. Life is a struggle right now, but there will be a future. I can manage this. I will get the help I need. I will be strong for my family. Abraham Maslow was the guy that had it right. I mean, what's at the foundation of everybody's pyramid? Physiological needs, food, water, shelter, and feeling safe. And the virus has threatened our safety. And that is why we need to work so hard on making sure we stay positive through all of this. And how can we do that? Well, we've talked about the importance of deep breaths, stretching, learning to meditate, get some exercise, put on the mask, go for a walk, maintain the physical distance. We can get out of our houses, and that does help. As Dr. Perez mentioned, today in Davie, Florida, happens to be a truly spectacular, beautiful day. At least get out in the backyard and get some sunshine. Stay in the moment. Focus on what is ahead of you right now, as opposed to worrying or awfulizing. More about that in a moment. In fact, I'm going to talk about a strategy called setting up a worry time. And we do have the ability right now to connect with large numbers of people through Zoom. We can connect with the cousins we haven't seen in years, aunts, uncles, somebody we went to school with and we haven't communicated with for years. We can do all of that now through the wonders of technology. And again, limit the news. They're taking us into too many hospital rooms, showing us way too many tragic stories where somebody didn't even get to say goodbye to their loved one. Concentrate on the things you can do to keep yourself busy. And the Substance Abuse Mental Health Service Association does have a national helpline, and there is that important number. Worry time. Tell yourself today, 7 o'clock tonight, I will go in my room. I will have all my awful thoughts about the worst possible outcomes. I will do that for 20 minutes, and that is it. And right now, I will focus on what is in front of me. I will stay in the moment, what I need to do for my job, what I can do to help my first grader who's sitting here working next to me. By the way, with younger children, obviously, it's much harder for them to work independently. Maybe you can set that 6-year-old up right at the corner of your desk, give them an assignment, and maybe you can get 10 minutes where you can truly concentrate on your work. And I also believe strongly that in our families, because we're all in this together, older children should be helping younger children. So let me give you an example. The 8th grade boy needs to be helping his 4th grade sister with her homework. He certainly understands it. He's now in the 8th grade. And the 4th grade sister needs to be helping her 1st grade younger brother. And everybody should be rewarded with verbal praise and, yes, monetary rewards. And unfortunately, some kids have told me they're viewing it like a coronavirus vacation. It's not a vacation for anybody. In fact, we're going to talk very specifically about the schedule for kids in just a few moments. But talking with others helps us. When we talk about something, it's like we get the problem from the inside to the outside. So think about who is that significant, positive adult in your life, and you need to talk to them about what you need in the way of getting through this. But control that worry time. So what should we say to our children? Well, I've already stressed, please begin with asking, what do you know about the virus? What is on your mind? I'm really here to listen and validate any and all feelings that they have. Now, has anybody had that slight cough? You don't feel well? You had a bit of a chill last night? Suddenly you're thinking the worst. Very important that we think positively, and all of us have been controlling our interaction with others for weeks now. So please don't go off the deep end when you have the slightest medical issue. And if somebody in your family does get sick, assure your children we will get them the best medical treatment possible. And remember, for the vast majority of Americans, it's pretty much like having a cold or a flu, and the vast majority of people will recover. And I know a lot of people are experiencing financial stress right now. And I think all of us that still have a job that is not in question, we need to be very thankful. And we need to help others. One of the things I'm proudest to tell you is 1974. Wow, that was a long time ago. I signed up to be a big brother in the Big Brothers program for Rodney, who was 13 at the time. Rodney never knew his dad. His mom was on welfare. Rodney was raised in poverty. One of my good friends have said, why are you still helping Rodney? You've had a relationship with him for 46 years. Why are you still helping him, not just emotionally, but financially? Because I can, and because he needs us to. Rodney is a custodian or a cook. He's never made much money. If he doesn't get to go to work, he does not get paid. So I'd like everybody out there to think about helping somebody who is less fortunate. And I'm proud that our university has started a support students fund, and I am one of the contributors. And I hope everyone else will contribute as well, because there are a lot of people that are really hurting financially. I mentioned uncertainty. We hate uncertainty. Unfortunately, we still have to deal with it. And we just need to realize that's difficult. I wish I could give our children the answer, but I cannot. We will just have to be waiting and control the things that we can control. And there's going to be a lot of questions at the end of the webinar, but person close to me, a grandma, would like to get in the car and go help our daughter and her husband with their 4 children because the family's in quarantine and the kids have school, the parents have to work. But right now, we can't go visit. So what can we do? Well, we can support our daughter and our son-in-law. We can be available to talk and text with them. And we can FaceTime with those 4 grandchildren and encourage them. And probably, since we've had a career in education, help them with their actual homework if that is what they need. So we can reach out to all of our extended families, whether they're in another city or not. So younger the child, the more it's about artwork. Get out the markers, poster board, draw. And those things are very powerful ways for younger children to express their emotions. Older children like to talk about things more. They're also very good at writing thank yous or trying to raise money or maybe even raise awareness to try to help people in need or to prevent something in the future. Developmentally, there are a lot of things our children can do. There are a lot of really brave Americans that for weeks now, they're the nurses and doctors going to the hospitals. They're the people delivering the food to the grocery store, the people stocking the shelves, the people delivering food to our door, the waste management people that come along and carry away the garbage. All of those individuals need to be thanked. And if your children are bored and they finish the school assignments really quickly, let's get them involved in a project to thank others. Over the years, I felt that a lot of teenagers, especially those in high-performing schools, those under a lot of pressure to get into just the right college, a lot of them are overscheduled because their school activities, their school teams, their community projects, those all conflict. Right now is the time your teenager could pick up and have more leisure activities or just pursue something of interest. They could pick up a guitar. They could try to learn to play guitar. They could research something. Maybe they've always been interested in trying to be able to sign at least a few words. Now is the time when they can do that. And maybe you'd be interested in learning guitar too. Maybe you'd be interested in learning sign language. The more that we can share some of these activities together, the better. Remember, we're all in this together. Patience, structure, tolerance, and love are critical in our families right now. So be honest and truthful with your children. Unfortunately, we don't have all the answers, but let's see if we can find out some information on that together. Acknowledge that what is happening is unprecedented. We have not dealt with anything like that in our lifetime before. What would help you feel better? What would help you feel safer right now. And continue to stress the vast majority of the people who get the virus, they do recover. Keep their brains and bodies busy. And let's look developmentally at kids' reactions. We talked in general about their regression academically, behaviorally, sleeping problems, nightmares, and worries, but let's look at them by ages. So what's it mean for a preschooler? Undoubtedly, it probably means toileting accidents, problems getting to sleep, maybe bedwetting. Maybe they do need to sleep with mom and dad again right now. Maybe there's more demand for your attention. There's more temper tantrums. They are whining. They are clinging. These are all things that present quite a challenge for us. But remember, patience, structure, tolerance, and love. Lower the bar for your expectations for your children. Lower the bar for your expectations as a parent. Our elementary age children, they also may need more attention than previously. They may be seeming to purposely pick fights with their siblings. They're more aggressive, they're more irritable, maybe they're complaining of a variety of somatic complaints. And they're going to need some help on that schoolwork. Maybe their older brother can help them, or maybe you and your partner need to trade off this afternoon who is on tab to help with the schoolwork. And with our adolescents in particular, some of the behaviors I've already talked about, but they might appear apathetic. They may be withdrawing. They may be wanting to spend all of their time in their room with the door closed. Frankly, I believe that we should not set an adolescent's room up to be a little kingdom with every technology device known to man in their room. I like to see all of that technology on the kitchen table or in the family room, rooms that you go in and out of. And I think it would be very reasonable to tell your withdrawing adolescent, no, they're not allowed to spend all of their time in their room. There are things to be done around the house and people who do need help. So just to repeat, and it's pretty obvious, preschoolers do not need to be watching the news, seeing the bodies being wheeled out on stretchers. Please prevent them from seeing that type of news coverage. And let's talk a little bit about the actual schedule for our children. I've emphasized over and over, in fact, a good friend of mine said, you know, an effective presentation tells them what you're going to say, then you say it, then you remind them that you said it. I began today with calm. Very important for adults to stay calm. Model optimism and hope for the future, for your children, for your entire family. Kids do best with structure and routine. Set up a schedule, Monday through Friday. Kids get up at the normal time. They get dressed. They have breakfast. They have schoolwork. Certainly we build in breaks and leisure activities and connecting with friends online, but there is structure. And even the youngest children, that schedule on the refrigerator, you can have pictures. Pictures of getting up, breakfast at this time, school at this time, now it's lunch. more school, leisure time. Now it's dinner, bedtime, structure. Kids thrive on structure. And reward your kids for getting those school assignments done. Now, there are over 130,000 K to 12 schools in this country. They're all doing their best. They're not all doing it exactly the same way. Lots of schools started out with paper and pencil assignments. Now everything is moved to online. But there's a lot of concern that some kids, even though the school loaned out laptops, they may not actually have Wi-Fi. And lots of teachers, and one of our daughters is a teacher, spending a lot of time calling and talking to children and their parents. But if you're a parent and you're not sure what you're supposed to be doing, or you don't think the school is going well for your child, teachers are working, counselors are working, assistant principals are working. Contact them with your concern. And what about children with developmental disabilities? The special education staff, and at your school, that special education staff knows your kid well. So contact them about whatever issues your child with a disability might be having. And I've been working with several schools lately around issues that have to do with tragedy. School personnel like psychologists and counselors, we know what to do if a member of the school community dies under normal circumstances while school's in session, but it's more complicated now. Yes, we must reach out to the family, reach out to the surviving siblings, reach out to the closest friends. And unfortunately, we can't even have the kind of typical grieving and funeral ceremonies that we are used to. But we need to let kids know that grandpa died, and no, we are not able to have the family gathering the way we normally would. When all this is over, we will have a gathering. By the way, you know what I've learned about kids? When somebody they know dies, all they really want to do is have the opportunity to talk about that person. So expressing those emotions through artwork, music, drawing, talking, ceremonies, rituals. Those are the things that help kids when someone they know has died. So technology, the good news, most adolescents know the technology much better than parents do. So that adolescent tech expert, they can be helping everybody in the family figure out the school technology. Now, here's the normal cycle for all of us about stress. We have jobs. Those create stress. We have a family. There are always going to be some demands put on us by our family. We get tired. We get stressed out. We need self-care. And I'd like everybody to be thinking about what helps you the most when you are under stress, because you need to use that strategy right now. This is definitely a time for self-care. And arguably the biggest word in all of psychology post 9/11/01 is resiliency. Probably everybody listening can think of somebody that you know that after the tragedy, their life was never the same. Maybe they never reinvested in relationships. Maybe they turned to alcohol or other drugs. Sadly, maybe you even know somebody who died by suicide. but you probably know other people who somehow went on with their lives. It makes me think about my best buddy, Rick, was driving in 2005 with his wife of 23 years in the truck. He lost control. It crossed the median on I-44 in Missouri. The median was narrow. There was no guardrail. Semi-trailer truck hit him head on, never even tapped its brakes. Debbie died instantly. Rick suffered head injuries, internal injuries, and shattered legs. 6 months later, he was able to limp out of the hospital. How do you go on with life? You see, resiliency is largely learned. It's the ability to bounce back from adversity. It takes time, effort. It involves a lot of steps, and it involves being hopeful about the future, because my friend Rick will always be sad about that accident. But when you are surrounded by loving family and friends, you do better. When you are comfortable venting strong emotions, when you have problem-solving skills, you make realistic plans and you carry them out, you do better. 6 years later, Rick remarried to a wonderful woman. He will always be sad about the death of his wife, Debbie, but he went on with his life. And that is really something that we all have to know. We will get through this. There will be better times ahead. And connections with other people are incredibly important. Those positive thoughts. We have to accept the virus has greatly impacted our world, and there's a lot of uncertainty about when it will be over. And we need to be flexible. We need to be creative. We need to be thinking about what fun things, new traditions can we start in our home with our children, something that they will never forget about how we managed all of this together. And what protects kids? I could spend the next hour on this. I already stressed stable families, family cohesion. We want that for every single kid in America. Unfortunately, they don't all have that. But school connections. I'm hearing a lot like, my daughter is devastated. She had the lead in the school play this spring. My son was looking forward to a great senior baseball season. By the way, dealing with disappointment is part of life. And no, it doesn't help to tell our kids, let me tell you about a big disappointment for me and how I got through it. We just need to say, I can't imagine how hard that is. I know you were so much looking forward to that play. Do you have any ideas about what might help you feel better? I know you wanted to play baseball this spring. Has anything helped? Have you been able to stay in touch with your coach, with your teammates? Would it help? Could we go out in the backyard and play catch? Because I'd love to do that if you would. We can't make all of that disappointment go away. And by the way, religion, whether it's a temple, whether it is the mosque or the church, it is a tremendous protective factor. And right now, we can do all of those religious services. We can participate online, and I hope many of you are doing that. So one of the things that I know has helped a lot of people. Family pets are like incredibly important. And, you know, even with my online classes yesterday, everybody was hugging and showing off their pets. This is Rocket. If you have cats, dogs, hug them, snuggle with them. In fact, I know our university did a webinar just on pets and how important they are at this time. So not only hug your kids, hug those pets as well. So on May 6th, as you're thinking about your questions, on May 6th, I'm doing a webinar for NSU on suicide prevention. Pretty much everybody is predicting suicide rates will go up. Well, we know suicide rates were at an all-time high in America prior to COVID-19. Suicide is the second leading cause of death for everybody between the ages of 10 and 34. Suicide rates doubled in the last decade for middle school age girls. Suicide rates are an extreme problem for our veterans and middle-aged Caucasian men. What about the impact of losing loved ones to the virus or our financial difficulties? I don't think anybody has all those answers, but now is the time when everybody needs to know the warning signs. Somebody's talking about death and dying. Somebody is making out a will. Somebody is giving away prized possessions. Somebody has dramatic changes in behavior. We need to directly ask, are you thinking of giving up? Are you thinking it's hopeless? Are you thinking of suicide? And if they say yes, our answer needs to be, you are not the first person to feel this way. There is help available. I'll be there for you every single step of the way. There's a national crisis helpline number. It's 1-800-SUICIDE. All I have to do is push a button on my smartphone. If I tell Siri, she offers to connect me with the helpline. The greatest thing holding suicide prevention back in our country is our unwillingness to talk about it. Now more than ever, we must talk about it. And I'm going to turn it back to Dr. Perez for questions.
Well, Scott, as you can see, we've gotten some questions already that have come in, and we've had questions that came in before, and there's quite a few responses to the pink ears. People are very excited about the pink ears. So I'm glad you bought your mascot. So many questions have come in, and let me try to go through them for you. Is it appropriate to refer to this as the Chinese virus?
No, absolutely not. I think we all know that one of our greatest challenges in this world is to all get along. And I actually have a quote right here at my desk from Gandhi. Our ability to reach unity and diversity will be the beauty and the test of our civilization. So no, we should not refer to the virus and do that with the name of a country.
So here's a question that I know that a lot of my colleagues have been dealing with. How am I supposed to work from home and help my kids with their schoolwork?
Yes, many parents now have 3 roles, and I would suggest make your kid and your family the priority, and hopefully your employer will give you a little bit of a break. Hopefully there's another adult in your household who can help out, And again, let the older kids help the younger one with their schoolwork.
And many more questions coming in. So some people are asking about registering for the other event. The website for that is very easy. It's nova.edu/Shark Chats. You could refer friends, and these events are free. They're a service to the community. Let's grab another question. This one's a little long. So I'm a retired educator. Our daughter is really stressed at this time, trying to teach school from home and manage her 4 children. I would like to help. This is a little bit of the question similar to the question you answered before. Any suggestions there? Further suggestions?
Well, be available to listen to the daughter and ask, how can I help? What could I do? And maybe that retired educator spending time online with the grandchildren and walking them through some of the assignments, encouraging children, but most importantly, always being there to listen to the daughter and just recognize and say, I can't imagine how hard that is. And just let me know, how could I be of more help?
So you're getting tons of questions coming in, and people are continuing to ask about the suicide prevention webinar. Again, the website is nova.edu/Shark Chats. I'll also offer the email is psychology@nova.edu, and we'll be able to refer you if you have difficulty. That's psychology@nova.edu. Let me pick another question. My 17-year-old son is calling it the coronavirus vacation and is up all hours of the night online, sleeping until noon. What can I do to change his schedule around?
Well, this is a really big challenge. And in my career, I encountered a lot of kids where they stayed up all hours in the night. Therefore, they were never going to be in school at 7:30 a.m. And I think we need to take a pretty hard line here, which is you will go to bed at a normal time. So you will get up Monday through Friday. And I've actually been very concerned that lots of kids sleep with their technology and that wakes them up. I think our answer should be, hand me all your technology. It's 10:30. It's a school night. I will charge them all for you and they will be ready for you in the morning. I had a mom argue with me one time saying, but what if my daughter's friends needed to talk to her in the middle of the night? They wouldn't be able to reach her. Well, Mom, I think your daughter's friend, if something is so serious at 2 a.m. in the morning, they need to talk to their own parents. But I did not convince that lady. She felt her daughter should be available 24/7 to her friends. And I disagree. In fact, I think one of the key things that'll help everybody get through this difficult time is getting enough sleep for the adults and for the kids.
So maybe take 1 or 2 more questions. We're getting a lot of comments and applause. We've had one person that applauds your comments on China and being hypersensitive to that issue. Another question that's come in, and this is kind of really hitting us home here, since we're in graduation season, and so not just the high schools, but also the colleges, universities. My daughter's school prom has now been canceled. She is a senior and she's looking forward to the event. It's possible she won't even have a senior graduation. How can I see her past these major disappointments?
Well, I think our tendency as a parent is to think, how could we make this right? how could we make this go away? And we can't. We need to be there to listen. I can't imagine how disappointed you might be. Is there anything that is helping you? Do you have any ideas about what we could do so we could be creative in any way? And it really rests with what idea does the daughter have? And as I said earlier, it's not a time to share an example of here's what I did, here's how I got through it. It's just, I can't imagine. That really sucks. And I just can't imagine it. But any ideas you have, is there anything helping you deal with that disappointment? So really, you're putting it back on the child. I'm here to help, but I can't make that prom or graduation happen.
Let's take one more question, you think? And you kind of touched on this one. It's just popped up. There's a few people asking for PowerPoints and additional information. You can email psychology@nova.edu, or you can email me directly, perez@nova.edu. perez@nova.edu. So one last fun question for the individuals that are contemplating a fur child. My kids have always wanted a dog, but I said we would never be home to train one. What do you think about getting one now?
I say absolutely. Dogs are truly wonderful pets. Yes, you can train, you can get a puppy now. And I think the family will benefit immensely. And Dr. Perez, I put up my final slide here. We all know there's certain behavioral things we need to do. And we need to keep doing those until we hear from our science experts that it's okay to stop, for example, social distance recommendations. But remember, you are the adult. You've had a lifetime of experiences to draw on. Be optimistic, be hopeful, be the model for your child, and set up management in your home to deal with all the issues of everybody being home together. Yes, it has been a struggle, and it will continue to be a struggle, but we will get through this as a country, and you will get through this as a family. And thank you for tuning in today. I apologize, my voice is a little raspy, but I wish each and every one of you the best on behalf of our university.
Well, thank you, Dr. Poland. I think you did a great job. I know you've been teaching quite a lot, and you've lost your voice for that reason. And I've certainly kept you busy with these webinars. One of the things I'd like to mention to everyone, we are Nova Southeastern University. We are now located in Davie, Fort Lauderdale, Florida. It's a beautiful day out, and hopefully you'll visit us someday. At the College of Psychology, we offer bachelor's, master's, specialist, and doctoral programs. We've got amazing students, amazing faculty. We're very proud of the Sharks. And some people are asking for our contact information. I'll type it again in a few minutes, but psychology@nova.edu, or if you want to reach me personally, my email is perez@nova.edu, and I've been getting a lot of emails, as you can imagine. We will send you a thank you for participating email that mentions some of the things that Dr. Poland mentioned. But one thing to note is we have a special webinar coming up next Monday, and we will send you information on that as well. But we are hosting one of our current clinical psychology students and a number of panelists, including myself, talking about higher education, inspiration. It's a great opportunity for individuals that need a little inspiration, young people, or somebody that's maybe been displaced with a job, We're going to talk about how to be inspired, how to be motivated, and that's going to be with Julius Thomas, who's a former Dolphin, Miami Dolphin, and some of my favorite colleagues. So this is a special presentation that I'm putting together, and I hope you'll refer us and tell friends. And I'm going to go ahead and add that. Any last words before I turn off our recording?
Thank you all for attending, and we wish you the best at this difficult time. Stay home, stay safe.